Hey everyone, I'm Dr. Matt Parker with Parker Physio, and I'm a physical therapist. And today we're going to talk about a muscle that often gets overlooked and one that can play a role in the low back pain, hip pain, knee pain, and IT band issues. The exercise is called the Sidelying Hip Abduction, and don't worry about the term, what that means. The key here is that we're trying to strengthen this muscle right here called your gluteus medius. Now, this muscle is really important when we walk or when we run. It helps stabilize our hips. So when I lift up like so, this muscle needs to activate to keep our hips level. And what ends up happening is if this isn't fired correctly, you do this kind of a deal. And when this happens, you start putting increased stress on this burst out here in the hip. You can put increased stress on your back and even increased stress on the inside part of that knee. So we really want to work on getting this muscle firing, and that's why we're going to do the Sidelying Hip Abduction. So I'm going to move my camera here. So you can do this kind of anywhere. I do it on the ground here. You'll lay down. And what you're going to do is you're going to strengthen this guy first, the left. I'm going to bring my leg just a little bit behind my body, so I'm going backwards away from the camera here. And then I'm going to go ahead and lift up, and I'm going to hold this position as so. Where you should be feeling this is right here on the side of your butt, okay? Now, many times people tell me they feel it here, or the quadricep, or they feel it in the low back, and even the other hip sometimes. And that's not what we want, okay? So what's happening is because this muscle hasn't been firing correctly, these other muscles are compensating to kind of get this leg up in the air. So, again, we want to make sure we're feeling it here, and we want to be able to hold it for at least a minute. Okay, so when we're able to hold that for a minute, what we want to do is we want to make this a little bit tougher. We want to put a band on. So this is my TheraBand, just like so, okay? And we can get this anywhere, any drugstore. You get it on Amazon for a few bucks, relatively inexpensive. You're gonna put your legs around, just like so. Lay back on your side. Good. Leg straight, leg up. All right, and again, I want to make sure, feeling it, boom, right here, and then I'm holding on for 1 minute. Just like that. All right, that's the side lying, because I'm laying on my side, hip, and then abduction is going away from midline. That's the exercise, and let me know how it goes. Thanks.